Alcohol, while commonly consumed in social settings or used as a means of relaxation, can have a range of harmful effects on both the body and mind. Understanding these effects is crucial because alcohol is one of the most widely used substances worldwide, and its risks can impact people from all walks of life. While moderate use may seem relatively harmless to some individuals, long-term or excessive consumption can carry serious, sometimes irreversible consequences. Even small amounts can be risky in certain contexts, especially for vulnerable populations such as pregnant women, individuals with certain medical conditions, or those taking specific medications. At its core, alcohol is a central nervous system depressant. This means that it slows down the brain's functioning, altering mood, behavior, and cognitive skills. When you consume alcohol, it enters your bloodstream and quickly reaches your brain, where it starts to influence how you think, feel, and react. Even after just a single drink, you might experience relaxation and reduced inhibitions. However, as consumption increases, judgment, motor skills, and coordination deteriorate. This is why alcohol impairs driving and is a significant factor in road traffic accidents across the globe. The risk is not just to the drinker, but to others as well. Acute intoxication, commonly known as drunkenness, brings its own set of dangers. Lapses in judgment can lead to risky behavior, injuries, falls, or accidents. In some cases, consuming a large amount of alcohol in a short period can result in alcohol poisoning. This medical emergency can cause vomiting, seizures, slowed breathing, and even death if not treated promptly. Young people, who may be inexperienced with alcohol, are particularly at risk for alcohol poisoning due to binge drinking. Chronic, long-term use of alcohol inflicts damage on nearly every organ system. The liver bears the brunt because it is tasked with breaking down and eliminating alcohol from the body. Over time, heavy drinking can lead to an accumulation of fat in liver cells, called fatty liver. Continued abuse may cause inflammation, known as alcoholic hepatitis, and can progress to liver cirrhosis, which is scarring that severely limits liver function. Liver cirrhosis is a life-threatening condition with no cure except for transplantation. The digestive system also suffers greatly from alcohol abuse. Alcohol irritates the lining of the stomach, which can result in gastritis or ulcers. It impairs the absorption of nutrients, contributing to malnutrition and vitamin deficiencies. Additionally, alcohol increases the risk of cancers of the digestive tract, including the mouth, throat, esophagus, stomach, and colon. Heart health is also jeopardized by heavy alcohol use. Drinking in excess raises blood pressure and increases the risk of stroke and heart attack. Alcohol can weaken the heart muscle, a condition known as cardiomyopathy, making it less efficient at pumping blood. Irregular heart rhythms, such as atrial fibrillation, are more common in those who drink heavily, and even moderate consumption can trigger such issues in susceptible individuals. Alcohol can suppress the immune system, leaving the body less able to ward off infections. Chronic drinkers are more prone to illnesses like pneumonia and tuberculosis. Moreover, alcohol interferes with the body's ability to regulate blood sugar, increasing the risk of type 2 diabetes and complicating its management in those who already have it. The impact of alcohol on mental health is profound. While many turn to alcohol to alleviate stress or anxiety, over time, it can worsen depressive symptoms and increase anxiety. Alcohol is strongly linked to a higher risk of developing various mental health conditions. It can lower inhibitions and impair judgment, leading to poor decision-making and strained relationships. The risk of self-harm and suicide is significantly elevated in individuals with alcohol use disorders. Alcohol's effect on the brain extends beyond acute intoxication. Long-term, excessive drinking can cause permanent changes in brain structure and function. This can manifest as problems with memory, learning, attention, and problem-solving. In severe cases, it can lead to a condition known as Wernicke-Korsakoff syndrome, a form of dementia caused by vitamin B1, thiamine deficiency, which is common in heavy drinkers. Alcohol use does not just affect the individual. Families and communities carry the broader consequences. Incidents of domestic violence, child neglect, and other forms of abuse are closely linked to alcohol misuse. Work performance suffers, contributing to lost productivity and financial strain. The healthcare costs associated with alcohol-related illnesses and injuries run into the billions of dollars each year globally. Alcohol is also highly addictive. Regular excessive consumption can lead to alcohol dependence or alcoholism. For those with this condition, stopping drinking is extremely difficult and often requires professional help. Withdrawal symptoms can be severe and even life-threatening, including anxiety, tremors, sweating, hallucinations, and seizures. Long-term treatment and support are often necessary to achieve lasting sobriety. For certain populations, such as pregnant women, the risks of alcohol are especially dire. Drinking alcohol during pregnancy can cause a range of birth defects and developmental disorders known as fetal alcohol spectrum disorders. These can result in lifelong physical and intellectual disabilities for the child. While some studies suggest that light or moderate alcohol consumption might confer some benefits for heart health in certain groups, the risks often outweigh these potential positives, particularly considering the risk of addiction and the broader spectrum of harm. Reducing or eliminating alcohol consumption is associated with numerous health benefits, regardless of one's age or drinking history. Improvements in liver function, heart health, mental clarity, and emotional well-being can begin within weeks of stopping or cutting back. For those struggling with alcohol use, a range of treatments and support options are available, from counseling and support groups to medical therapies that help manage withdrawal and reduce the urge to drink. Society's perception of alcohol as a harmless social lubricant belies the reality of its risks. Education, prevention, and support are vital in reducing the harm alcohol can cause. Being informed and mindful about drinking habits is the first step towards safeguarding not only personal health, but also the well-being of families and communities. The harmful effects of alcohol are far-reaching, touching on nearly every aspect of health and social life, but with awareness and support, the journey toward a healthier relationship with alcohol, or total abstinence, is entirely possible.